After a very long winter here, most of us are coming out of hibernation only to discover a long list of beauty dilemmas that need to be fixed just in time for summer. Whether it's excess hair, aging necklines, or those extra stubborn pounds. Dermatologist Dr. Marilyn Berzin is going to talk to us about some fast fixes for this summer. We like this, and there's a lot of new laser treatments out there, and you usually think of laser treatments and think of a lot of money, but not true now.
Well, not necessarily the case. We have new technology. For instance, we have a new laser hair removal called a light shear duet. And the beauty about it is it has a much larger head so that you can in fact do a whole back or a set of legs. What used to take about an hour and a half now can take about 20 minutes.
20 minutes?
20 minutes.
How painful is that?
Oh, this technology is wonderful. It uses vacuum suction. It zaps the cells. There's absolutely no topical anesthetic needed. And the people who have tried the more standard lasers and this new light shear duet have found a huge difference. So it's quick and it's painless and
good to know.
Absolutely.
Now, usually I've heard when people go for those treatments, they have to keep on coming back. I have a couple treatments to really get it done. Still the same way?
Absolutely. You have to catch the hair at its most vulnerable stage. So there's usually an interval of time between treatments, and it takes about 4 to 5 treatments to get permanent 75 to 80% permanent hair removal.
So who do you see in your office? Because women will admit to this, but guys won't. You see both, don't you?
We see a lot of backs. This has been absolutely...
For men?
For men, absolutely. There are a lot of men who are very self-conscious about their hair, which has always surprised me, but they don't like it. They don't like to get undressed. So this has been wonderful. It's quick, it's rapid, they're in and out of there quickly, and no topical anesthetic needed. And because it's so quick, we've been able to reduce the cost. So we've...
How much are we talking about now?
Oh boy, anywheres from $100 to $200 the bikini area to $400 to $500 per treatment. So
it sounds much better than before.
Significantly less.
Talk to me about darker skin. Before, I guess you'd always hear that wasn't as safe to get some treatments. Well, that's changed?
It has changed a bit. We still have trouble with white hairs and pale hairs. We also have trouble with dark skin. But with this new technology, we are able to not have as much trouble. So we can go darker than we used to, and it may take a few more treatments, but it's a lot better than it has been.
Let's go over a list. These are the types of treatments that most people may not know what they are, but you see them in the girly magazines, the women magazines saying this is in, this is trendy. Fraxel Restore, am I pronouncing that right? Right.
Well, Fraxel Restore has been the mainstay for years. It does microscopic zones of heating up, and it's been the best treatment for acne scars, wrinkling, and some discoloration. What they've done is we've improved the technology and we've added a second form of treatment, so we've upgraded our machines, and it now has what we call a 1927 head, which specifically targets pigmentation. So dark spots, age spots, melasma, mask of pregnancy. It only requires some topical numbing and requires about 2 treatments. Virtually no downtime and very little pain, and so that can be used chest, neck, arms, all over body parts.
Not just the face.
Not décolletage, arms, hands, all the things, the places we get these dark spots that we hate.
That are always there and you want to get rid of. Next up, intense pulsed light, IPL.
IPL's always been around. It's it takes several treatments. It does rejuvenate the skin. It targets brown spots, but more importantly, it will target vessels on the face, redness around the neckline, the chest as well. So,
are you having like all ages come to see you?
Oh, absolutely, absolutely.
Well, I want to talk to you about that because it's been in the news a lot. You've probably heard of reality TV star Heidi Montag, who looks like a Barbie doll and still wants her boobs to go out to here.
Oh,
I mean,
God,
it's a little
yes,
crazy.
It is.
But how do you deal with your patients? Say if you have someone coming in that's young and you look at them and they don't need it, but they have the money and they come in and they say they want this, this, and this.
Well, I think you have to evaluate each case individually, obviously. Hair removal, easy to do.
Yeah, not a big deal.
Not a big deal. Botox, we're seeing them a little bit younger. I think the most important thing, especially in a young patient, is to make sure you educate them on sunscreen precautions, and educate them what to do for anti-aging and things like that.
In your opinion, as a doctor, do you think a doctor has a responsibility to counsel a patient if you think maybe they don't need something or they're being excessive?
Oh, absolutely. I say no all the time. I think, you know, we have to evaluate what the issues are. If they're treatable, absolutely, we go ahead and do them. If they're reasonable, we go ahead and do them. But I think a doctor has a responsibility to say no, or this is not what you need, or this is too much.
Some people are going down, you've heard of it, going down to South America because doctors down there tend to not say no to different things here in America doctors would, you know, shy away from.
Yeah. No, I mean, you have to, as a physician, you have to live with yourself, and you have to figure out what you would do to your own daughter. And I think there are times where you do say no, and there are times where it's very reasonable to fix certain flaws and problems.
Yeah. Okay. The next two I want to go over before we go: injectable fillers. People know about these a lot. I mean, we're talking about Botox.
We're also talking about Juvederm and hyaluronic acids and fillers such as volumizers. So there's a whole list of things that we inject in.
Are they getting cheaper?
Not really. The companies have not lowered their prices.
Up there, right?
The demand is there, and it is the fastest. You know, we're doing a lot of facelifts in a needle. I mean, people are avoiding surgery because they're too costly, especially nowadays. And we're finding that we're doing a lot of Botox and fillers and laser resurfacing. People want quick results, little pain, no downtime, and they have to be back at work within a few days.
And they want to look good. Dr.
And they
Berzin,
want to look good.
Thank you for coming in and breaking it down for us.
Thank you so much.
Appreciate it.